Good morning, ladies and gentlemen of the jury. Thank you all for coming back and ignoring the loud and high level of white noise behind you, or take advantage of that, and please feel free to close your eyes and sleep. In this particular session today, what we are going to address is some critical issues with respect to fake online pharmacies. And this is going to follow up some of the material from the first panel discussion, as well as do some analysis from our perspective of more law enforcement, regulatory oversight, and what should and can be done in this space. In this particular panel, what I'll try to do is first provide a contextual overview so we're all on the same page with respect to at least some of the regulatory challenges, some update on research that you've heard a little bit about already today, and then we're going to sit and talk with the experts in this field who are actually going to educate us and give us some insights as to what has to be done to actually effectively address this tremendous public health issue. Now, as you can see to my left, we have three distinguished panelists. We have first Dr. Amelia Arnold. She's a pharmacist, practicing pharmacist from the state of Maine. We have Special Agent Daniel Burke from the FDA-OCI. Of course, he also heads up some of the cybercrime efforts in the United States. And then Gigi Levine, she is from the National Association of Boards of Pharmacy, working in policy and communications. So these people will provide us with tremendous insights with regard to what has to be done with regard to this problem of online pharmacies and really the illicit nature of them. So let me move right forward into this presentation and first talk about a little bit of context with respect to illicit online pharmacies. Again, I'll echo what some other people have said, that most of you know a lot of this information, but many of you have some less detailed understanding of some of the aspects. So we'll just give this all as a basic primer before we turn to the panel. First, let's just talk about the role of regulation. Basically, regulation of online pharmacies, or pharmacies generally, is done on two levels, state and the federal level. With respect to the state level, we're talking about pharmacy boards. And pharmacy boards basically do what you might expect them to do. They write and they license and they do a variety of other things like supporting pharmacies, and as well, they discipline. They discipline errant pharmacists as well as errant pharmacies who are not following the standard rules and codes as defined by pharmacy regulations. So that's our really primary safety mechanism on the state level. Now, on the federal level, it's slightly different, but very similar in terms of its goals. Safety is the #1 goal by the FDA. And they do that in a variety of ways. For drugs, we definitely test for safety and efficacy in a wide array of settings, everything from branded drugs, investigational new drugs, generics, you name it, they do it for safety purposes. As well, for drugs as well as cosmetics and other materials, safety as in correct labeling also is a very prime goal of the FDA to make sure that what you're buying and what's on that label is actually what it says it is and it's in fact safe. So in both these circumstances, with drugs and other materials, the idea is safety. Again, reifying the notion that safety is the #1 priority, both on the state as well as the federal level. Importantly, we have to really distinguish the fact that the FDA regulates the materials in the pharmacy, not the pharmacists themselves. Now, this creates tremendous challenges for trying to regulate online pharmacies. Regulating online pharmacies is a huge, gigantic problem, and this probably can be traced back to all the way 1997, 98, when we first saw Viagra coming online in the internet. And this was something that was done and detected through Pfizer and through some of the tremendously important efforts of John Terrio at that time there, as well as Aaron Graham. Those two people actually were pioneers in trying to fix this particular problem. Unfortunately, the problem just got bigger and bigger. In the mid-2000s, FDA starts to warn about this very openly. Unfortunately, despite the fact that the FDA has a lot of imprimatur, didn't stop. In 2007, we started to see more and more warnings from the FDA about mislabeled materials, stuff that was purportedly coming from Canada but actually was not, and so on and so forth. So we got a lot more information about the dangers associated with these online pharmacies. In the policy realm, what we tried to do in 2008 was legislative fix. Ryan Haight, Online Consumer Pharmacy Act, and then Justin's Law in Minnesota, both memorializing two young men who were killed on the basis of materials that were obtained through an online pharmacy. Now, I should mention here that Ryan Haight died actually in 2001. So this took a long time for us to get to that fact that we were going to get legislation on the federal level to try to address this issue. And not to discount the efforts that it took to actually do this work, it was woefully behind the times. As everybody knows, from 2001 to 2008, that's a 6-7 year period, the internet has changed, our computers have changed, we have something called phablets and tablets and all sorts of other mechanisms through which you can sell, buy, and trade over the internet. So the realities of 2001, 2002, 2003 are completely irrelevant to the internet realities of today, as Tim Mackey noted in some of his presentations. In addition, things got worse, because what we started to find was, even despite efforts, legal efforts that we were trying to do to stem this tide of illicit activity, what we started to find was, in fact, it was expanding. Search engines started to play into this game, including AdWords selling. This led to the Google $500 million settlement that most of you know about. As well, what we started to find was in 2011, social media became one of the most important facets of advertising and marketing from these illicit online pharmacies. And this is work that Tim Mackey and myself was doing back in those days. This got progressively worse. The more we looked, the more we found. You're seeing a lot more different kinds of medicines than are being available now, including those shortage drugs. And it's just not the US shortage drugs, it's the global shortage drugs that are now being found, being sold by these guys. And again, it raises the question, if somebody in a legitimate supply chain can't get it, how come somebody in an illicit chain is getting it, and what's that quality? Furthermore, with respect to the advertising mechanisms, it got even worse. That we found that it's not just search engines and it's not just social media. There's a combination now that are being used on these for marketing of these illicit activities, these illicit drugs, and unfortunately, this as well is just growing and growing and growing. And you can see the economies of scale for the folks who are trying to sell this stuff illicitly. It's cheap, almost free, to put your advertisement on Facebook or put yourself into a search engine organic search. The combination of the two is a deadly combination, and that's actually what's happening today. As well, Tim this morning mentioned that it's gotten to the point where now we're seeing we can buy drugs before they're even offered. Belviq was the example here. This was a tremendously important drug that was being approved but not yet released because it hadn't been DEA'd, it hadn't been scheduled. These things just came out. Well, again, the more we looked, the more we found. You literally could find it no matter where and how much. Kilogram, you could get it for everything from the pills themselves to kilogram quantities of the material. 2014, who knows what's going to happen in 2014, but I assure you that these guys are not stupid. The criminals are very facile with what they do. They take advantage of the internet and marketing, and so therefore what has happened is that the online sphere has become the sphere to obtain all and illicit drugs. Now, we do have some third-party efforts that have tried to stem the tide here, and probably the most famous one is the NABP's VIP system. The VIP system is the Verified Internet Pharmacy Practice Sites system. It is, in fact, the toughest accreditation program out there today, and it really is a success in global governance. You can see the people who are involved in creating this. Every public, private, government agency, non-government agency, patient advocacy groups, all these people got together and decided this was an important enough issue for them to join. No law was required, just the coordination of interested, interesting people who felt this was a public health issue. So this is a tremendously important program at this point. In addition, we have another program called LegitScript. This is also a third-party system. This was started by John Horton, who used to be with the Office of National Drug Control Policy in the White House. This also is a very, very robust, rigorous system for analyses. Uses a different business model, but importantly, rigorous certification standards that have been validated over and over and over again. So those are some efforts that we're trying to use beyond our traditional law enforcement to try and identify these particular practices and do something about them. Now, some consumer information that we really should be understanding so we can try to figure out what's the best way to approach this from the patient's end. First, with respect to consumer knowledge, consumers are really highly unknowledgeable about what is going on here. Unfortunately, they don't recognize that this is mostly unregulated activity. that in fact the drugs that they buy, they may be from the Canadian website or UK website, but the materials are coming from all over the world. We know that already. Even in the Avastin cases, we were seeing they were coming from Turkey and other sites. As well, we should also point out that this is a legal activity. There is no such thing as a 90-day exception to allow wholesale importation of drugs, whichever drugs you can get on the internet. That's a false activity. That's a false claim. Unfortunately, people still are claiming that. And then, of course, most importantly, many of these drugs are available as generics and are cheaper right around the corner. You don't have to go outside of the United States to get these particular drugs. So this is a really significant challenge that patients don't realize they have an advantage by buying and looking for drugs in this country. Now, some of the consumer behavior research that has been recently coming out reifies this extensively, this lack of consumer information and challenge extensively. In a recent study that was done in Michigan, about a quarter of college kids who were given websites that had, some of them had high risk, obviously fake online pharmacy characteristics, others did not. Unfortunately, these are the kids. These are kids. These are ones who are facile with the internet. They know what the internet's about. They've grown up with the internet. Even these people who are, in fact, the users, a quarter of them could not identify problematic websites that were selling illicitly. And that included a subset of individuals who are actually studying in the health professions. So even health professionals can't really discern the difference between what's a valid website selling drugs versus a non-valid website selling drugs. I should also mention that there's just been a new study that was released. Between 5 and 8% of emergency room admissions for people under the age of 25 is associated with a drug that was bought from a quote-unquote a non-traditional source, either over the border in another country or mostly about 70% online. Further, additional research has been coming out with respect to social media. People in the 20 to 40 age group, and now up to the 20 to 50 age group, are really attracted to no prescription sites. And primarily, this is going through the social media pathway. Social media seems to be the #1 source by which younger individuals, and I call them younger, 20 to 50, because I am over 50 now. And as you can tell, if you saw me from last year, I didn't have these, what are these things called? Glasses? I didn't even realize that you had to wear something on your face to be able to see, but at the age of 51, it was automatic. But in that event, they are attracted, and not only are they attracted to these sites, amazingly, these sites simply don't care if they have illegal material, illicit sales material on them. We reported to you last year that we did a study on the 4 major social media programs. We put up a fake website, a clearly illicit, no prescription drugs, et cetera. We did, of course, the standard thing to do. You put a nice-looking female on it. You put a fake award on there, cheapest prices, et cetera, et cetera. Completely illicit, completely illegal, obviously illegal. And over a 10-month period, we got more than 3,000 hits. And now remember, we're not selling product. We got over 3,000 unique hits from all over the world. Well, okay, we stopped the study, we published it. When we looked again for this particular event today, all of those sites are still working. All of those sites are still getting hits. We actually published this information, and Facebook and Twitter and other social media entities really don't feel any threat from us. We're just academics, so what can we do? And subsequently, they have done nothing to actually address this issue of clearly illicit activity going on in their own platforms. And unfortunately, there have been efforts by NABP and others to try to do something about this, and again, it's been falling on deaf ears. In addition, I just wanted to reify the study that Tim mentioned about NTI drugs. Neurotherapeutic induced drugs, I can assure you, as a physician, these are the ones that keep us up at night, because you just don't know when a patient is going to hit the toxic dose versus the therapeutic dose. And they're so darn close that you may shift a patient's prescription to say, you'll take this at noon rather than at 6 a.m. That change is enough to increase the dose to the toxic level rather than the therapeutic level. So when individuals who are going to try and get their own drugs, their own NTI drugs, online, they're going to be faced with a significant issue of whether they're actually going to do this right and not kill themselves. Importantly, because of Obamacare and the health exchanges, as many of you know, the exchanges and the insurers in the exchanges will not have to cover more than one therapeutic product per therapeutic category. So if you're somebody who likes a particular product and has worked for you as an NTI drug, and it doesn't work for you, and you say, that's not going to work for me, I'm going to go buy the one that I'm used to, it's going to force these people to go online, and they're going to go right into a system which is going to cheat them, and even worse, perhaps kill them. So this is a significant issue for us now, as we've seen the development of how these online pharmacies are working. So that's a brief overview of what we're going to be talking about with the panel, and I'm going to join them right now, and we'll start talking about how these issues are going to be addressed in the future. Gigi, I want to start with you. Now, I've just put out some of this information. This is all old information to you, isn't it? Or is this something that we need an update to?
It's something that's been an ongoing problem, definitely, and we're seeing a lot of trends recently that show that this problem is one that's not on its way out anytime soon.
And from the point of view of NABP, what's the next step? You've looked at the kind of the prevalence of these problematic websites. What do we do about it?
Well, because a lot of these operations are multinational, the regulations of the state boards of pharmacy and even FDA alone are not reaching all of the parties that are involved. You're seeing maybe a call center in Canada, base operations in the Bahamas, server locations in China, and you've got wholesale distributors at multiple points in between. So what is beginning to happen and is starting to bring about some positive change, I think, is the collaboration of international multidisciplinary groups that can take some accountability at their little section of that distribution process.
Can you give me an example of a global entity or group that's actually doing this kind of work?
Well, there's a lot of networks that operate hundreds of, potentially thousands of domain names selling prescription drugs illegally, and they'll have a central fill location and offer basically anyone with an internet connection the option to create an affiliate site, and all they have to do is take the orders, and then the main company will fulfill those orders, getting them directly from excuse me, manufacturers in third world countries, or that's just it. As you touched on earlier, you just don't know where they're coming from.
Now, Dan, what have you been seeing? What have you been seeing about in this new world, and as well, how do you counter some of the stuff that Gigi just pointed out?
Yeah, I mean, especially in 2013, it's been an interesting world in online pharmacies in the specific context of criminal investigations. So our agents are looking at sort of each point along the way, the ecosystem. We're primarily focused on the source of supply, but you see this proliferation of affiliate networks and spammers, and it sometimes can sort of lead us down rabbit trails that we don't want to go down. And so it's been an interesting world. I call it the sort of Snowden effect. It's been more challenging as a result of the ecosystem sort of clamping down on our ability to gather information and conduct these criminal investigations. And they are absolutely multinational. Gosh, we've seen, as you described, sources of supply in India, China, Pakistan, Turkey, but we have customer service personnel, say in the Philippines. We've got perhaps the brains of the operation. In fact, one of the agents here in the room and I went to Israel and did search warrants with the Israeli police. And the brains of the operation were located on a yacht in Tel Aviv Harbor. It was a fascinating case, but the entire operation was essentially run from that yacht in Tel Aviv Harbor.
So can you explain, give us a flavor of how these criminals work? How does the system work?
Well, you go online, I mean, you can learn how a business model works. I mean, we look at the business models as far as, how are we going to conduct the investigation? And we can see that there's a similarity in business models that are developing. And maybe that's through, we take one online pharmacy network off and they study how the business model works and they replicate that. But it's very simple to set up an online pharmacy. I mean, we've set them up. I mean, it doesn't take very long. You set it up, essentially. I mean, it doesn't take long. And the infrastructure, the ecosystem, as we talked about, that's there. It's in place. And there's a number of parts of the ecosystem that sort of facilitate illicit behavior. And I'm talking about, obfuscation, who is obfuscation services. Now, it used to be you could go on and say, well, what domain name, what's this registered to? Well, now, registrars and whatnot are selling obfuscation services. It's difficult to get that information. And we're seeing that now on the server side, too, where it's kind of getting more and more difficult to us to find exactly where the websites are hosted. And so, unfortunately, that's sort of what's developing in the online world as far as at least our niche in criminal investigations.
How do you access that information? What do you do with it when you need to go after the bad guys? What's your strategy to actually catch these guys?
Well, I'm not going to give that up.
We're among friends.
It's
as a general matter.
As a general matter, I mean, any criminal investigation is just looking under rocks. And the entire ecosystem is a bunch of rocks, whether it's the payment processor, whether it's where the servers are hosted, the source of supply. We need to identify each and every step in that. And so we're looking under those rocks. And it's got to be comprehensive. And we have to prove beyond a reasonable doubt in a court of law. I mean, that's our goal. We're not an intelligence agency. What we do at the end of the day comes out in court, or it's foiable. So we've got to cover every base. And getting that information is getting more and more difficult.
Okay. Now, what about, Dr. Arnold, what about that? What about, are there any, for example, online pharmacies that you know of that are starting to act in the state of Maine that are doing bad stuff?
Yeah, there's one in particular who really sponsored legislation, and I'm not sure how familiar everyone in the room is with this, but the state of Maine recently passed legislation that in their minds made legal the importation of drugs from 4 English-speaking countries, which are Canada, Ireland, New Zealand, and Australia. And the legislation was sponsored primarily by CannaRx. They're a broker, as they say. They're not actually a pharmacy that connects you with the right people to fill your prescriptions overseas. And they came in with a marketing scheme to the Maine State Employees Union, which just completely brainwashed everyone to think that these drugs are safe. They're being filled from Canada and shipped right to me. And we've had a very hard time breaking down that conception that there are risks to this. It's just, these are safer. I actually testified in front of a committee where the legislator who told me he thought it was safer to get his drugs shipped from Ireland than to come to my pharmacy and get it filled from me.
Outrageous.
And what's interesting, just to add to that, because of that legislation, really the main marketing scheme is Canadian pharmacy. But now we're seeing, Irish pharmacy, Australian pharmacy. We're seeing the countries that were specifically identified as safe, pursuant to the Maine legislation, we're now seeing that used as a marketing scheme online.
And what we've really been trying to get through to people is that this law didn't just open the door for CannaRx. This law opened the door for those spam emails that you get that say, buy Viagra online from Canada. That is now legal in the state of Maine, questionably legal in the state of Maine. And that's what's hard to get through to people is if you wanted to license CannaRx, you should have just licensed CannaRx or put something in place with oversight with the Board of Pharmacy, not just exempting them from the Board of Pharmacy and any sort of oversight and opening the door, because there's no one checking to make sure these legitimate pharmacies are overseas. The legislation...
You're telling me there is no oversight by CannaRx. They do not assure quality on any level.
They do not, specifically CanRx does not. You sign waivers saying that you can't go after them if there is an error made. And our point has been that they claim they've had no errors in 10 years of doing business in Maine. They actually were doing business with the City of Portland employees for 10 years. And they say we've had no errors. And what we come back with is if no one's watching, it's really easy to say that you don't have any errors occurring.
Does legislation allow for, let's say, the Maine Board of Pharmacy to enter, do surprise inspections or audits?
No, it completely exempts them from any oversight from the Maine Board of Pharmacy. It says that they have to be licensed pharmacies in the country of origin, but no one's checking to make sure they are licensed pharmacies in the country of origin. And it's my understanding, if you don't, in Canada, if you don't provide drugs to Canadian citizens, then Health Canada doesn't oversee you either. So basically, there's no one overseeing them. There's no checks and balances in place for their products.
So a product can come from Ireland, from somebody's bathtub, to CanRx.
Or to any company, not just CanRx.
Okay. And then be transshipped into Maine, and no one's looked at it, no one's assessed quality, and I'm a resident of Maine, I put that in my body. I take the risk then?
You actually are, when you read the paperwork, it says that the only place your drug might be held up is by customs agents. So they recommend you order it 3 weeks ahead of time because there's no guarantee the customs won't seize it. But other than that, there's no oversight.
There is absolutely no oversight. So now, Gigi, this can't be right? This can't be the way to run the railroad. What is NMEPP thinking about this?
Well, we're thinking that more people need to be aware of it in the healthcare community as well as the consumer community. And I think one of the important points that a lot of people are not aware of is that the drugs that you order from the U.S., in the U.S., from these Canadian online pharmacies, those drugs could be coming from third world countries and are not, excuse me, are not legal to sell in Canada. But as long as they're being imported for the purpose of export, then that's okay. They're not held to the same level of accountability. And also, when you kind of step outside that established supply chain, with every change of hands, you introduce a new opportunity for counterfeits and substandard drugs to get into the mix.
Now, is there a way to identify which particular online pharmacies are valid and legitimate versus non-valid? Are there any approaches that you're thinking now at NABP?
Well, you mentioned our VIPS program, which is Verified Internet Pharmacy Practice Sites. We've been doing that for a little over a decade, and more recently, we launched an Internet Drug Outlet Identification Program, and what we do there is really take a look at the alternatives to the accredited pharmacies. And since 2008, our staff has looked at over 10,000 websites selling prescription drugs online to U.S. patients and found that 97% of them are out of compliance with state and federal pharmacy laws and practice standards, the ones that have been established to protect patient health. So you step outside of that and you might be getting the right thing, but the odds of getting something that's counterfeit or that is not what you're expecting to receive is way higher.
And what about the top-line domain .pharmacy?
Right.
Why don't you give us some information about that?
Sure. Last year, NABP applied to ICANN to own and operate a .pharmacy GTLD, that's a generic top-level domain, and that refers to the suffix at the end of an internet address. For instance, the common ones are .com, .net, .edu, and in the next few weeks and months, you're going to start seeing more and more new top-level domains start to come online. And among those is going to be .pharmacy. So what we're doing with that is we're working with stakeholders internationally to make sure that any pharmacy that has a .pharmacy domain name is going to be thoroughly vetted to make sure that they're in compliance with pharmacy laws, not only in their home jurisdiction, but also in those countries where they're doing business. So we're hoping that that is going to provide a really strong awareness and safety tool for consumers to find legitimate online pharmacies.
Amelia, what do you think? I mean, as a practicing pharmacist that actually dispenses drugs, would you be going for the .pharmacy appellation, or?
Well, I think as a profession, we always advocate that the safest way and best way to get your medications is to walk into a pharmacy and have a relationship with your pharmacist. That being said, we're not against mail order. We're not against patients finding drugs from other sources. We just would like them to be verified legitimately. So I think that anything that can put oversight in place and really guarantee the patient's getting a drug that says or is what it says it is, we would be open to. It's not that we don't want competition, and I think that's been the hardest part of this battle, is that everyone just accuses us of being greedy and wanting the money for ourselves, where we're trying to open the eyes to a larger issue here.
Mm-hmm. Now, Dan, what is the .pharmacy thing going to do? I mean, does that help at all any kind of law enforcement activity, or is this perhaps just somewhat of a smokescreen that maybe some illicit guys are going to try to use?
Well, I think there'll probably be some efforts, but there's going to be enough sort of policing by NABP, and we work very closely with NABP. So I think in that sort of top-level domain, it's going to be fairly clean. I'm hopeful that it will be very clean. I think you're going to have a certain segment of the population that's just going to go to .coms and .nets or whatever anyway, because the price is probably going to be much lower, as we've seen.
But with the pricing effect, my concern would be that we have a .pharmacy system, which is it's kind of like Consumer Reports kind of imprimatur. The challenge is in Consumer Reports readers, they're looking for highest quality, longest use of the product. But is it that our pharmacy market is really looking for the cheapest price? So how do we address that cheapest price customer with some kind of approach, .pharmacy, VIPs, whatever, that's actually going to take their needs into account? How do we do that? How do we deal with the mom who needs Lipitor, or the mom that needs something for antibiotic that she needs for her kid, or somebody needs some kind of specialized medication, an NTI drug? How do we deal with those people? Because they're not necessarily dishonest. They're just a little misinformed. Because I think that the FDA has tried to do a lot in education, but I don't see the benefits. Or am I wrong? Am I wrong that education is not, maybe is education doing the trick?
No, just a funny story. I was talking to my sister, my own sister. I know this is on video, sorry. I was talking to her about, online pharmacies, and she said, well, I can just go to a Canadian pharmacy and get what I need. And despite our education campaigns, my own sister still felt that a Canadian pharmacy, and so we had a long discussion after that. But, I'm hopeful that NABP will have an education campaign along with .pharmacy.
I think it's hard too, because being from Maine, I mean, a lot of us can see Canada, chances are, and so you have to break down that misconception, but I think it's all about educating the patients, and it starts at the pharmacy. If someone walks in and says, I can't afford this, don't turn them away. Talk to them about what the issue is. Get in touch with the doctor. Look for generic alternatives. Look for patient assistance program. Look for 340B clinics that you can connect them with. So there are options, and that's what we're trying to drive home, is that this is not, this is being billed as a fix-all, but there are other options out there. They take some time, but the solutions exist. We're just not utilizing them fully.
Now, what kind of marketing is the Maine pharmacist doing to try to educate the population? I mean, it's a difficult state, urban, but a lot of rural. What do you do about that?
Well, right now we're taking it a day at a time. The law just passed and went into effect at the beginning of October, so I'm not really sure that you've seen a whole lot. There's been a lot of press lately because a lawsuit was filed to try to stop this law from taking effect on the grounds that it is against federal law, so Maine doesn't have the authority to do this. Other than that, I talk to a lot of people who just don't want to listen, and I think there's those who've already made up their mind, and other than that, the Maine Pharmacists Association is very involved, the Retail Association of Maine, Maine Society of Health System Pharmacists, getting the news to their members that the members need so that the people on the front lines can better address it.
Gigi, is the NABP working in this area in Maine, or are you directly working there?
NABP has publicly stated that they are not in favor of importation in Maine, and one clarification I think that needs to be maybe further publicized is that, yes, if you go into Canada, if you cross over the border and you go to a Canadian pharmacy and go in and talk to your pharmacist, yes, those drugs are almost certainly safe and approved, and they've gone through Health Canada channels. It's when you're buying from an online so-called Canadian pharmacy that there are a lot of variables, a lot of unknowns as far as where those drugs are originating and what kind of oversight there is on that supply chain.
Now, I'm curious because when I see the online pharmacies that are advertising on this side of the border, they're either not requiring prescriptions, or they will have you fill out one of those stupid forms that are just absolutely ridiculous. Put 50 pounds in and fee your dog's information and you'll still get the drug. But the other thing that I'm really concerned about is the professional aspect. I don't see, when I look at the online pharmacies, I see a pharmacy student supposedly overseeing the prescription drug being packaged. I see a Canadian physician supposedly writing her or his name on a prescription pad indicating that this is a valid prescription for Fifi. Is there any way to leverage that clearly illegal and misleading approach on our side of the border? Can we take advantage of any of those things?
I mean, it has to do with, in the Food, Drug, and Cosmetic Act world, we deal with misbranding. And so, a drug dispensed without a valid prescription is misbranded. Mm-hmm. And so there is a sort of criminal sanction there for that. That's one aspect that we look at in any sort of criminal investigation is, how is the drug being dispensed? Even if there's an online questionnaire, in cases where they require a prescription, we've sent a bogus prescription and no problem, we get our drug anyway. So, and you're right, we put Fifi down or whatever and still get it. So.
Well, the reason I'm curious about this, I remember back in the bad old days in 2009, where a physician in the United States was signing 25,000 prescriptions a day, and he's an American physician right in San Diego, and was being paid $5 a prescription, and was working 1 day a week, and was driving an awesome Porsche boxcar. You knew who this guy was because his license plate was Pill 1. But I'm thankful he was caught. But the challenge was that we said, wait, you're signing prescriptions for patients you've never seen, and that's unethical, and that can get you pulled up in front of the medical board. Well, the same effects would that not be the case in Canada? If somebody is signing prescriptions without seeing exactly the patients that are supposedly getting these treatments, should, number one, that physician be busted, and then number two, any pharmacist or pharmacy student who actually uses that prescription to create a package of drugs that are sent over the border, that seems like the classic example of professional misconduct that should be actually assessed and penalized. Is that not the case in Canada? Do they not care about that stuff, or what is the deal? Because at least in the United States, we slap the wrist of the guy signing 25,000 prescriptions a day. I guess he only signs like maybe 4,000 or 5,000 now, but back then we got him. So why can't we stop it from on the basis of providers, illicit providers who are engaged in this activity?
We've engaged both Health Canada and the RCMP on many fronts, and I think there's a lot of sort of well-intentioned folks up there. I haven't come across a case just off the top of my head that involves an actual Canadian doctor. Okay. We're seeing doctors not only in the United States but in other countries as well. But I know that Health Canada has they have engaged, or they're at least trying to see legally how they can help us in this effort. The laws just don't support. If the criminal act is occurring in the United States, according to their law, they just don't have strong sort of laws that we do on the opposite end.
Amelia, professional responsibility. Shouldn't there be some massive in red in the newspaper indicating these are the bad guys?
Yes, there should, but we've come to terms with, in Maine at least at the moment, that we're on the right side of an issue but the wrong side of public opinion. And it seems like no matter what we put in the newspapers, the articles seem to get skewed, or we still come out as, again, just being greedy and wanting to line our pockets. So it's an uphill battle, to say the least. You know, when this issue came about, we had talks of, okay, we want to try to stop it legally, but also, do we want to try to sway public opinion? And we just kind of keep back to, we will answer questions when approached, or, you know, we're very happy to talk to the media, but we're not actively engaging them in trying to get our message out there.
How about the Ontario Pharmacists Association? What are they thinking about this?
I don't know what they're thinking about this.
Okay, interesting. My own, several years ago, when we interacted with them, they were certainly not favorable to this kind of activity. In effect, they said Canada can't be a United States drugstore. And yet that's exactly what seems to be happening. We are seeing that flow right now through that northeast part called Maine. But where is that going to end? Is that going to move from from Maine to New Hampshire to Vermont to New York State to, I mean, is this going to be, or what's your thought about that? Is this really going to become a domino effect?
I think it potentially could be a domino effect, which is why we are trying to get the legislation overturned legally based on federal grounds, because I think that's everyone's fear, not just the Maine pharmacists or Canadian pharmacists, but pharmaceutical manufacturers, patient advocacy groups. You know, the patient panel earlier shared that what the impact had been, and we try to get that message across as well, that this has a large potential for a domino effect, and what's going to happen to Canada and how they can price their medications. If we're going to just buy all our drugs from them, you have to figure that something is going to give. Canada can't supply the entire United States with medicine, so.
But again, these aren't drugs that are coming from Canada necessarily.
In some instances they do. In some instances they come from Ireland, Australia, or New Zealand, according to legislation. But within a couple of weeks of the legislation being passed, patients were coming in and bringing me pamphlets they received in the mail about drugs being imported from Thailand and Turkey. And so those pharmacies luckily can still be warned by the Board of Pharmacy, because they're still under the purview of the Board of Pharmacy. The other 4 countries cannot at the moment. And it's something the board tried to do. It's not by any fault of their own that this happened, but they have no authority.
So under those situations, then, if there is a quote-unquote suspect country outside of the 4, you can go after them. But if they're within those 4, you can't.
Well, they can be issued warning letters by the Board of Pharmacy. You know, I'm not really sure what's going to happen after that, sort of someone going to investigate them. But yes, they're still under the authority of the Board of Pharmacy. Those 4 countries are not.
All right. Now, if in fact you do send a warning letter, what happens after that? Is there any enforcement power, or do you have to?
Well, someone has to complain or bring it forward to the board's attention before anything can happen.
So unfortunately, that means you've got to find somebody to complain. And if you don't, everything goes on continuously without anybody actually looking up.
Well, and that's what we saw with CannaRx in Maine, actually, is that they were operating with the city of Portland and another company called Hardwood Products for years, and no one complained about them. I think that I had certainly never heard of them, but I think other people had, just in the back of their head. And then what happened was the Maine State Employees Union tried to contract with that, and suddenly they got a little too big, that everyone took attention, and that's when the legislative efforts stepped in. So I think that's probably what's going to happen with this issue across the country.
Gigi, do you think that is it going to be a public domino effect, or is it going to be private? Is it going to be, in other words, state governments doing it, county governments doing it, or is it going to be companies doing it?
That are wanting to
create these, sidebars, not getting direct online access through quote-unquote Canadian pharmacies.
Well, we're seeing it on both fronts, and what those 2 groups have in common is that they want, it's in everyone's best interest to protect the public health, that the patients who are receiving these medicines, that they're actually getting the benefit and not being, duped into receiving and taking something that is not healthy for them, not approved through the FDA's approval process, and for the drug companies, they put a lot into making sure that the products they put out are meeting all standards. And so then if another product gets out with their name and it turns out to be something completely different, well, that's not in their interest either. So on that area, you know, I think both public and private groups are coming together and wanting to, you know, create some accountability so that the regulations that have been established are continued on, even though supply channels and business models have largely expanded the scope of these individual jurisdictions. They do come together in terms of wanting to maintain patient safety.
So the question is, Dan, do we have the tools to fight this? Do we have the tools to do what we need to do?
Talking about specifically the Maine legislation, or are you?
Generally.
Online pharmacies, and you know, look at, I mean, when it comes to controlled substances, you have the Ryan-Haight Act, and those powers are great. When it comes to non-controlled substances, the powers are weaker, if you will. We could use a lot of legislative tools. For instance, just give you a quick example, even a domain name. I mean, you can set up a website in a matter of minutes or hours or whatever. It takes us days, weeks to get a subpoena. And in the time that we were able to get that subpoena from the Department of Justice, U.S. Attorney's Office, that it could have been, you know, a website that no longer exists. So, you know, having the ability to quickly subpoena information would be very helpful. We just don't have that right now. I mean, there certainly are other investigative tools that we need to sort of combat this issue along the lines of what DEA would have or ICE would have under the Ryan-Haight Act.
Such as?
Well, administrative subpoena, money laundering, tied to money laundering, administrative forfeiture authority. Those are the types of tools that would allow us to more nimbly act when it comes to an online pharmacy.
Now, does the assistance of, for example, Operation Pangea, does any of that help you to actually go after bad guys you otherwise would not be able to get access to?
Not otherwise. I mean, Operation Pangea, if you're familiar with this, is sort of an Interpol coordinated effort to take off a lot of you know, illicit online pharmacies. And usually what it ends up being is, you know, like last year we seized 1,677 websites out of an online pharmacy network that probably has upwards of 10,000 websites. So I sort of likened it to cutting the fingernail off a dragon. It just sort of grew back, you know, afterwards. But the important point about that the point was we wanted to get the word out about bogus Canadian pharmacies. I mean, these were websites that were saying that they were Canadian pharmacies and clearly were not. They were using domain names that had like CVS and Walgreens in them. They were using fake FDA seals and symbols to try to, you know, get U.S. consumers, and it was geared towards U.S. consumers, to try to get them to go online and purchase drugs through them. Mm-hmm. So it was more of an education campaign in that context.
Okay. Now, Amelia, what do we need? I mean, we just heard about the federal level, but certainly states have their own individual unique needs. What do we need?
You know, that's a really great question. I think, first of all, we need legislation in Maine that doesn't make it legal.
Right.
So that needs to go away, would be the first step. And I don't know. I mean, I've had patients come into me and say, well, I want to get this as the brand drug. I don't want the generic, so I'm going to buy it online. And when they have that notion in their head, and, you know, to sit there and try to explain, well, you might not actually be getting the brand. This is safer than maybe getting the brand name from somewhere else. I don't know, educational tools. I would say the support of the fact that when things are going on that they can be shut down. So when a company like CannaRx comes in with blatantly illegal activity, that something can be done about it.
Does the Maine board actually cooperate with law enforcement?
The Maine board would absolutely cooperate with law enforcement, and this case, again, it's not under their authority to do so at this time. So.
But is there a way to actually be creative and find a way to get law enforcement to be involved? Because certainly I think the feds would be saying, wait a minute, this is importation, this ain't your deal, states. Is there a way to hook up with the national guys, or is there a way to do something like that, some kind of cooperative act?
You know, I'm really not sure right now that there is, especially given in Maine we view it as a legal activity, as something they can legally do, so.
Well, we're here to help.
Yes. Yes, hopefully in the future.
Okay.
You know, when it all came about what was happening before the legislative battle started with CannaRx, the Board of Pharmacy issued warning letters. The Attorney General's office stepped in and said, I trust you will stop operating, and they did. And now this legislation has changed all that. But if we could get the legislation off the books, The Attorney General, depending on the political climate, has in the past stepped in. I'm not sure that will continue because it is a very politically based issue at the moment.
Well, wait, what did the Attorney General say when this was pending, when the bill was pending?
Well, the first Attorney General, because there was a shift midway through this, the first Attorney General, William Schneider, issued letters saying this is an illegal activity, this is why, if you want to fix this, you're going to have to get the law changed. Then there was an election, and he was gone, and the new Attorney General, Janet Mills, returned. She had been previously, and we heard that she really didn't issue an opinion much different to the legislatures than the previous one, but they still passed the bill. And so when the lawsuit was filed, she was faced with having to defend it, even though there was never an official opinion given. So she's trying to defend it at the moment. We are waiting for a date in court.
Okay. Now, Gigi, you come from kind of the broader base of all the boards of pharmacies. What can we do to cooperate to try to address this issue, this online pharmacy issue?
The problem with trying to maintain control of pharmacy practice over the internet is that most of these operations have no connection to a licensed pharmacy in the United States. If it were a brick and mortar pharmacy that people could walk into and investigate, then there would be something that the boards could do. They could shut them down. They could revoke licensure. The fact that these remotely and foreign operated sites are not under the auspices of the state boards of pharmacy. So again, that's kind of where the collaboration comes in. The boards have established safeguards for pharmacy operation in their states, and there needs to be additional collaboration between them and the individuals who are enabling these rogue online pharmacies to continue to operate. So we need to get those safeguards in place more broadly. Because you're seeing this from a more broad point of view, what are the new things that are starting to come out? What are the kind of cutting edge issues where we as a general group don't know about, but of course you guys at NABP do know? I would say that the main theme that we've seen over the years is deception. These rogue websites go to great lengths to make themselves appear legitimate, and they'll go as far as posting fraudulent licenses, fraudulent VIP seals, and they present a lot of just deceptive information about what is allowed under FDA's importation laws. And so I think that a lot of what needs to happen is that people need to be educated about what it is that's going on, and then be able to make more informed choices. So we're seeing deception in terms of marketing tactics and in terms of products that are being sold. A lot of let's see. In the last quarter, NABP discovered, I think, 109 additional websites that were out of compliance, and the vast majority of those were selling unapproved generic knockoffs of name brand drugs, ED drugs specifically. So, it is not only a trademark violation, but it's a safety threat because the offenses went far beyond trademark violations to include dispensing without a valid prescription, and various other illegal operations that are not good for consumers.
What about your VIP seal? Is that being counterfeited?
It has been. The authentic VIP seal is click to verify. So users should be able to click on the VIP seal and be taken to a page on the NABP website to see, to confirm that they are in fact accredited and appropriately licensed. But yes, we have seen instances where that image is counterfeited and posted fraudulently.
And where does it click to? When you find the fraudulent one, where does it go to when you click?
Some of them are not clickable at all, and some of them will go to a fake page. And for consumers, for the average consumer, they may not be aware that that's not a legitimate document. So, so again, consumer education, I think, is key to make consumers aware of the dangers that are out there and to pursue options that are going to protect them.
In our research, we found that when you click on it a couple of times, they use the fake seal. It was hard to find, but when you click the fake seal, it goes to an affiliate site. So you just buy from a different site. It's just not a difficult issue. I actually now want to kind of turn to a different issue. Dan, what do you think, with expansion of, under the ACA, of the number of people that are going to go into the healthcare system, is this going to change the dynamic for you in enforcement? How is this going to work, do you think?
My initial thought was it's just going to get even harder. So, we'll see. There's a lot of unknowns right now. Exactly how it's going to expand the online marketplace, the illicit online marketplace.
So just hum a few bars as to what you might think is going to happen. Where are like 2, 3 largest vulnerabilities as the expansion of the ACA occurs?
Well, let's see. As far as sourcing drugs online, gosh, I mean, on one hand, you could see that with more Americans getting insurance, that there will be, a more likelihood that they will source their drugs from the legitimate supply chain. I mean that could have a very beneficial, a good benefit. On the other hand, what I believe the market could go to more is what we talked about sort of earlier, is more of the healthcare fraud, fraudulent practices with regard to pharmaceuticals rebilling the government, as we see in Medicare and Medicaid fraud. So, I could see a big shift towards the sort of the rebilling schemes that we talked about this morning.
Okay. Amelia, what do you think? What's going to happen to the ACA?
Well, I think there's going to be more people with insurance, which again I would hope would bring more people into my pharmacy. So hopefully, I like to take the optimistic outlook that more people will legitimately be able to buy their drugs. So I think I'll try to think that for now.
That's a great optimistic thought. It's great. Optimism from Maine. That's great. Gigi, what do you think? Do you think things are going to be a little bit better or a little worse?
Well, I wanted to piggyback on on Amelia's comments, and you were saying that you have patients coming in who are looking to save money on medications. Would you say that most of them have a clear understanding of what an FDA-approved generic drug is versus what an online pharmacy calls a generic drug?
No, most people don't understand that.
Are they focused on cost, or what's the difference there?
Sometimes there's brand loyalty to the proprietary product that they think they need to get, and then you have to try to explain that Lipitor might not be the same in another country as it is here, and it might have a different name, so why don't you go with this FDA product? Sometimes it's about cost, and anything that's less expensive they'll take. Unfortunately, with the way some of these programs were designed, specifically with CanRx, is that if you fill your generic at a pharmacy, it's $10 a month. If you get your brand name drug filled overseas and shipped to you, they waive your copay completely. So it actually incentivizes those patients to ship away for branded medications compared to generic alternatives.
So they understand the financial incentives, definitely, sounds like it. But Gigi, you've seen this from a 30,000-foot view. What regulatory pressures can we bring to bear to start limiting this? Because I'm anticipating that with the expansion of Medicaid patients, there's going to be a lot more vulnerable people with insurance, and with the limits of one therapy per therapeutic class, there may be people who want something different. So do you see any way to ensure that we don't fall into this trap of having a bunch of people going online and trying to buy their drugs that way?
Well, there are a lot of different parties along that trail from manufacturer to the customer that are spreading false information and making making these transactions possible. You've got, you know, everyone from the manufacturer down to, you know, the registrar who allows the illegally operating website to continue selling drugs illegally. And so we're seeing a lot of US-based registrars and some abroad as well to start to hold their customers accountable. And if some of these website operators that have purchased a domain from them, if they're operating illegally, many registrars will, you know, work with, you know, enforcement and patient safety stakeholders to take those sites down. There are still other registrars, for instance, you know, many of them, you know, outside of the U.S. that are saying, you know, not our problem. And so I think that there are a lot of people in that chain, you know, call them choke points, where they have the opportunity to stop this. If they know what's going on, they have the opportunity to stop it, to not let it go out there. And I think the more you know, collaborative efforts that we're seeing between public and private entities, the more we're going to see some demands for accountability.
Okay, now Amelia, do you think that, are you personally seeing pushes for accountability from your clinic, from your pharmacy? Are people saying, you know what, we want to see quality information, you know, from Dr. Arnold? Is that happening?
I don't see that yet, but one thought that I want to share to piggyback off what's been being said is for Medicaid expansion and for Medicare, drugs from Canada or other countries cannot be used for those patients, and that was clearly put forward in Maine. They briefly said, oh, can we use these for our main care population? And you can't. So everyone who ends up on a Medicaid expansion is going to have drugs within the closed system. So that's definitely one benefit of the Affordable Care Act. As far as accountability, it's really hard to say. Like I said, you know, I had a legislator tell me that it was safer for him to get his drug overseas than from my pharmacy, which was a mile down the road. So, you know, I'm not sure accountability is something the general public understands when it comes to pharmacy practice.
Now, yeah, Dan, you know, obviously you're super national. You're dealing with this as well, you know, across borders. Compare for us what's happening. I mean, if you're a regular old Canadian citizen and a regular old United States citizen, getting drugs from your individual countries, is that okay? Is that safe?
From within the supply chain, the secure supply chain, sure.
Sure. All right. Now, can a Canadian buy a online drug from a U.S. pharmacy, online pharmacy legally?
You know, I don't know the answer to that question. I know that I've been in other countries and tried to access online pharmacies that are up and running in the United States, and they're not accessible.
Okay.
So, for example, so there are certain Canadian internet pharmacies. You go to Canada, you can't reach that domain. It's geo-blocked. I mean, you're just not going to be able to order from that, even though it's a Canadian pharmacy. Okay.
Now, if you're you should shift back a little bit, and let's say you're in Manitoba, and you want to order something from Maine. Can you? I mean, right now we have this law that allows folks from Canada, drugs from Canada, to go into Maine. Shouldn't there be reciprocal rights?
I see Amelia here thinking of a new business model. Let's start shipping, you know, overseas medications into Maine. See what happens.
I think the problem would be is that they're going to be more expensive in Maine, so there's probably not a lot of incentive to go the other way.
I mean, they have national health care, and I mean, correct me if I'm wrong, but there's sort of price negotiation that goes on at the Canadian level that doesn't occur in the United States. So.
I'm thinking more of drugs of illicit activity. So the morphine derivatives, Schedule II drugs. It's getting tough to get that, but
an addict's going to go wherever he or she will go to get that. It doesn't, you know, online's a great source for that, but it could be down the street corner. So
right,
it's not going to change. Yeah.
So the current dynamic then is still the same, that we are the buyers and we buy from around the world. That's the standard.
When we take off or we take a look at a SQL database or a database of all the customer transactions at an online pharmacy, I have yet to see one that's less than 80% U.S., where the customers are 80%, U.S. based. The rest are a hodgepodge of other countries, and UK, etc. Okay,
so there are socialized countries that are actually still accessing product here, or online product.
But interesting, in my analysis, just on my investigations, most of those are ED drugs, drugs that folks don't want to go in because they're embarrassed to buy or otherwise, or controlled substances.
Okay, so, but are we seeing that's the standard claim by many people who say importation is just fine. It's because it's only, it's just lifestyle drugs. So is that the empirical reality, that it's lifestyle drugs that you're seeing?
No, but when you look at, we do see a lot of lifestyle drugs, but when you look at the crimes that we investigate associated, like if you take an entire online pharmacy, one of the easiest sorts of crimes to charge is counterfeit Viagra. I mean, Viagra, Pfizer has copywritten the blue diamond shape and the pill itself, and it's just commonly counterfeited. So it's easy for us to take sort of the low-hanging fruit and take that to the U.S. Attorney's Office and say, hey, listen, this online pharmacy is selling a host of other drugs, but here's an easy charge, and we get to charge the case. And so that's why you see a lot of the the sort of counterfeit Viagra cases or Cialis or something, because they're sort of easier than the rest.
Okay, Amelia, when you see people are somewhat questioning, I want to get my branded product, and particularly this legislator says it's better for me to go overseas and get it from your pharmacy, which, by the way, I hope that you're not voting for this guy.
He got a little piece of my mind.
Well, have you noticed yourself, is there a demand for life-saving drugs in your facility and less so of any kind of lifestyle drug?
Most of them are chronic medications, so drugs for, the number one drug was Nexium that CanRx was going to send into Maine, Cymbalta. So I'd say a lot of them aren't necessarily life-saving drugs, okay. They're more of maintenance medications. But there were life-saving drugs on there. One that sticks out in my mind when I was reviewing the request for proposal that the State of Maine Employees Union had was Gleevec. A chemotherapy drug was on the list of being that. And why would you want to get that from overseas instead of a legitimate source?
Yeah, and I'm sure that the biologic nature of it, I'm sure they're taking real fine care of the transport and no dropping it and right. so forth, right? Right. So Gigi, does NABP have a thought about how to do this, how to deal with, first, is there an oversupply or an over demand for lifestyle versus life-saving drugs, and what can we do about it?
I would say that the majority of websites selling drugs online are selling lifestyle drugs, and but there's certainly a full range of medications that are available through websites and through gray market channels. And so I think part of what NABP is looking to do is focus on supply chain issues. We have an accreditation program for wholesale distributors, and we're recognizing trends where there's a lot of middle people where we have recently added a category for virtual manufacturers and virtual distributors where many parties along the way may take ownership of the drug, either the actual drug or the title, and pass it along without ever having necessarily received that product. So there's just a lot more people in that supply chain and a lot more opportunities for for violations that are that create patient safety risks. And the internet, I think, is just sort of an expanded, magnified version of what ridiculously complicated supply chains can do, and the internet makes it that much easier. So if we pass things like pedigree and RFID and track and trace, where there is, again, accountability of where are these things coming from, that seems like it will be a major area where we can make a difference.
Okay, so we're out of time, but I just want to ask each of you one more time, if there was one thing you could actually miraculously have done to fix this problem, what it would be? Dan, what would the one thing be that would fix this problem?
The first thing that comes to mind is the Food, Drug, and Cosmetic Act, I think, was substantively passed in 1938, before the internet could have ever been conceived. So I would just do a nice reworking of the FDCA.
Okay.
Small
detail, just small. Amelia?
I have to say, of course, make the Maine legislation it's been in effect, but go away. So.
Gigi?
If we could just somehow immediately make everyone aware of what's going on behind the scenes and what's really out there, I think people would think twice.
Well, thank you very much, and thank for all of you for listening, and please help me thank these guys for coming up.